Hi, everyone. I am Mark. I am from the Green Party of Allegheny County. Um, I am the secretary. Just lost my video. There we go. I'm here because I'm active in the Green Party, like I said, the Green Party of Allegheny County. Um, I also am working full time in an immunology lab. I also am going part time to school for infectious disease and microbiology, and I figured it would probably be a good thing to give everybody the basics about coronavirus because I feel like there's some information that is not being quite translated to people that aren't in the field as often. And I know the big guns are working on getting testing going and telecommunication for doctors to see patients online. So there's no physical contact to prevent spreading coronavirus. So I'm going to give the basics of coronavirus in a few different sessions just to make it easier for everybody to understand. I've looked at the scientific literature and I can basically give you an idea of what's happening, why it's so important for self-isolation. So basically what you've heard before is I've been hearing that coronavirus is airborne, and that isn't the case. It's not the definition of airborne. So basically, and sorry for my drawings, I'm not a great artist here. What we have here is, and everything's backward because it's on video, my first time doing a video. So what we have here is we have this guy that's infected, sneezing, and the air droplets, the water when you expel when you sneeze, contain the virus particles. That's not the definition of airborne. That's air droplets. The virus clings to the air droplets, but as your sneeze, the mist of your sneeze falls to the ground, so does the virus. So this is why they recommend, which is backwards, why they recommend being 6 feet apart. Because if somebody sneezes and you're 6 feet away from them, you are most likely not to be in the mist that they produce as they sneeze, so that you won't be infected. So this is what self-isolation is. There's another situation where if the person sneezes, say on their cell phone, and you borrow their cell phone, touching their cell phone with the virus on it, and then you touch your face, your eyes, your nose, your mouth, you can then become infected with coronavirus. So this is why we're talking about washing your hands. Soap's very important. If you have hand sanitizer, it also works, but we know people have hoarded that. If you have hand sanitizer and you can't get to a bathroom or someplace to wash your hands, that's the best way to kill the virus is the hand sanitizer, but probably the best way is always soap and water anyway. So you want to make sure that you lather up really well, get in between the fingers and down to the wrists. Anything that your hands touch, say if you're on a bus and you touch the railing, you don't want to then touch your face. So you're just going to treat it as you get on the bus, you touch something, just assume your hands are contaminated. Wash your hands thoroughly before you touch your face, your eyes, mouth, or whatever. And that's pretty much how you can avoid getting coronavirus. There's also, so basically I live alone and I'm not having any symptoms so far. For me, it's absolutely quite worthless to sanitize any of my surroundings because if I have it and I'm putting it on a doorknob, I already have it. If you suspect a family member might have it, or even if you don't, because a lot of them are asymptomatic, it's important, although weird as it may be, to keep distance 6 feet away from children and spouses, which I know can be impossible. But if you really want to avoid spreading it around your family, if you suspect somebody has it or if you're not sure, isolation inside the home can also work, and that's when you want to disinfect, and really disinfect well, especially if anybody's come in and touched the table or whatever. Just keep in mind, whatever you're touching, if your hands can be contaminated, you want to decontaminate them. If they touch something like the table and you think they were contaminated, your table's now contaminated. So decontaminate that. Wash your hands before you eat. And after you eat, and if you come in contact with anyone, shake their hand, which you shouldn't be. But it's important to self-isolate. And these are the things that epidemiologists and people in public health are trying to get across to everybody. It's physically, like I said, the mist droplets falling to the ground. Gravity will take it down before it gets to 6 feet, before it travels to 6 feet to you. But obviously you want to be safe and not really be around people, because like I said, a lot are asymptomatic, and you're not going to know if you get infected, and these are the people that are spreading it to our elder community and causing the outbreak. And like I said, infected surfaces like cell phones. So if you have to work and you use your cell phone and you use your own computer at work, when you come home, ethanol them, disinfect them in some way. Because if you wash your hands and then you touch your computer that was out in the world and you touched it with dirty hands that have, coronavirus on it, you're going to touch your face and you're going to get it. So, just disinfect things, especially if you're coming from work, like I said. But that's pretty much what you can do to avoid coronavirus. There's no reason to really panic. There's no reason, especially to buy the toilet paper like crazy or the sanitizer. But I will bring you some more videos on different subjects. This is how coronavirus spreads, and I feel this is the most basic fact that you need to know. And if you can just see in your mind how it travels, you'll know how to avoid it. This is something we learn I'm a microbiologist. I'm right now in an infectious disease and microbiology program at the School of Public Health at the University of Pittsburgh. I work in biohoods. I've worked in different labs, infectious disease labs, and I'm right now in an immunology lab, transplant immunology. We deal with pathogens, obviously, so we don't get infected because they're human samples. So I've learned not to touch my face, wash my hands often. So these techniques can help you if you're worried about the information out there, you don't have enough information. These are the basic techniques that you can do to save yourself from infection and your family from infection. And like I said, I'll be back with some more. Hopefully these videos work out. Thanks.